you know there are 4 stages to vestibular migraine? My name's Amy. I'm a vestibular physical therapist, which means I treat dizziness and balance problems for a living, including vestibular migraine. Vestibular migraine is one of the 5 types of migraine, and it's a specific type that involves dizziness, vertigo, and imbalance symptoms. Vestibular migraine comes in 4 phases: prodrome, aura, attack or headache phase, and postdrome phase. In layman's terms, I want you to think of those 4 phases as the warning phase, the headache imminent phase, the attack or the assault phase, and the hangover phase. The prodrome phase or the warning phase is the first phase. It is the phase that can last anywhere between 5 days and 3 hours pre-migraine attack phase. Symptoms of the prodrome phase include irritability, yawning, sensitivity to light or smell, lightheadedness, and can vary from person to person. The aura phase is experienced by some people, but not all, and some people experience it some of the time versus not all the time. And it can last anywhere between 60 minutes and 5 minutes before a migraine attack. What differentiates the warning phase or the prodrome phase from the aura phase is sensory changes. Think of your senses: your sense of sight, your sense of touch, your sense of smell, your sense of hearing. These things get affected during an aura phase. You'll have things like seeing wavy lines or flashes of light or having blind spots. You may also have ringing in your ears or sensitivity to loud sounds or certain smells. You might also have numbness and tingling in your skin. Phase 3 is the headache or the attack phase. That is the phase where you're having the actual migraine attack. With vestibular migraines, only about half of people who have vestibular migraine experience head pain during a vestibular migraine attack, but if they do, it's usually only on one side, either the right side or the left side of their head. They also will have symptoms of severe imbalance, spinning vertigo, diarrhea and vomiting, etc. And the attack phase can last anywhere from 4 to 72 hours. And finally, phase 4 is the postdrome phase, or known as the hangover phase. It can last anywhere from 1 to 2 days after a migraine attack episode. The hangover phase is usually a feeling of fatigue or difficulty concentrating or difficulty understanding things or tolerating certain upright activities. It's really important to note that the examples I've given here are not necessarily always going to be what every single vestibular migraine entails. Each individual experiences vestibular migraine differently, and each individual also can experience different types of migraines depending on the stimuli and the severity of the migraine itself. Join me in my vestibular migraine playlist, where we're going to talk about common triggers that may trigger a vestibular migraine for most people, and how to identify your prodrome symptoms so that you can try and curtail a migraine right when it starts.